All right, we are on time. Good evening, everyone. Let me just close the window or the curtain so that it's not. Um, there we go. So we can have better light. There you go. Okay, good evening, everyone. How are you guys? I hope you're all doing well. And I'm so happy again to be here in our live session. And I just posted it like few hours ago from my FB page. And I know that some of you guys are very excited to hear the answers for the three questions. But before that, I would like to welcome all the new subscribers to our channel. Thank you so much for considering our channel as one of the helpful ones. And of course, sometimes I'm uploading daily vlogs, or I could say personal and family vlogs. So thank you so much for your support. I really appreciate the sharing of the videos and even the comments. Some of the videos that I did before, like a year before, it was like yeah, just like last year, I had lots of questions and comments and positive comments that I read on my videos. And thank you so much for that. Continue to share my channel to the people who are in need, especially for those who have kids or individuals that has autism and behavior like issues and even skills deficits, so that they can learn also that there is a field that is called applied behavior analysis, which is a science that we are manipulating the environment so that we can see what are the variables that directly affect your child's behavior. Okay, so we are checking the direct functional relations from the behavior that we are targeting and the environment. Okay, so again, before we go, I would like to introduce myself. My name is Jocelyn Pimangnibin. I'm a board certified behavior analyst, international behavior analyst, and a certified autism specialist. So I'm so happy that I've been in the field of applied behavior analysis for about 7 years now. And it is very exciting. It's an exciting field, and it's very reinforcing in my side when I see some kids that are developing and some kids that are talking from the time that they're not talking. Well, I'm not giving false hopes. I'm just saying ABA works. Okay, so when you do the science properly, and there is proper guidance from behavior analysts and people who are really doing the implementations according to the science, then it is very effective. Okay, so let's try to jump into the three questions, in which these are generic questions, okay, that I picked from the random questions that I received long way back when I was having live sessions on Facebook. So I decided to make the live session here on YouTube. Number one, because for me it is easier access to do things in YouTube. And since I'm not really into technology, so the easier, the better for me. And then the next reason is that I can easily record it and then just post it and just share it to my Facebook account. So I hope you understand, all right? So I would like to shout out all the parents out there who has been listening to this channel, and thank you for your support. Darlene from California, from America, and the other parents around the world. I hope the one in Canada is also listening right now. And of course, to my fellow Filipino people, mahal ko po kayo, mabuhay kayong lahat. Thank you so much for your support. All right, let's go to the 3 questions. Number 1 question, at what age a child should have ABA or should be assessed? Okay, so again, the beginning of the level of going to ABA is assessment. What we are assessing the skills. We are assessing the language level of your child, okay? All the skills, daily living skills, social skills, all right? So we need to assess them. If you're asking, I'm gonna connect this to the first question, at what age we should assess? Well, as early as possible. Okay? We have different kinds of assessment tools. But for me, I'm comfortable using VB-MAP and AFOS. Okay? It is a good combination of like integrated skills from zero age up to all the way like to 12 or even higher than that. But the VB-MAP is usually up to 6 years old. But sometimes it doesn't mean your child is 6 years old. Sometimes the children are really not having that skills, like complete skills. Okay, so we are using tools so that we can see what are the levels of your child, what are the things that your child can do, what skills, and even the academic side that your child can perform, so that we know which level we should start. So at what age we should start assessing them? There's no limit actually. Okay, so in VB-MAP there is a level for 0 to 18 months. Okay, though they have the targets, the domains. What are the domains? Like requesting, eye contact for social, and then tact or naming, and so on and so forth. So we have this tool that we can start with the 0 age, okay? So it doesn't really matter as long as you, parent, can see that your child really needs to be assessed, okay? And to be honest, you need to be more keen to observe your child. If your child is really in need of OT or speech or ABA, why not try, okay? One at a time, and then see to it what is the best solution for your child. But for ABA, there's no specific age that you should start with, okay? So don't be hesitant, parent. If you feel that your child needs to be assessed, please go to the behavior analyst and or the therapist with the supervisor to just guide the therapist on how to assess your child. All right, so question number 1, done. Question number 2, do we need formal diagnosis? I'm pertaining about the psychologist's diagnosis and the pediatrician, the developmental pediatrician. Okay, I love when the parents gave me some reports from the formal diagnosis from psychologists or the doctors, the pediatrician, developmental pediatrician. However, it will not be a prerequisite. It's not a prerequisite for me to assess the child. It's okay. If the child doesn't have diagnosis yet, it's fine. Okay? So in that part, for psychologist and developmental pediatrician, it's not really that a requirement. However, if I notice in the first meeting or before the first meeting started and I interviewed the parents, if I notice that the child has in need of physical, okay, medical check to confirm that the physical aspects are okay, then I would require the parents to send their child to the physical doctor, okay, just to check everything. that the child can perform physical activities, that the child can do things, okay? Like in action, or there's no physical aspects that hindering the child to perform any skills. Okay, so I hope it's clear. First set for the doctors, pediatrician, developmental pediatrician, and psychologist, that is a diagnosis for developmental, okay, and the skills. It doesn't matter if you don't have formal diagnosis. Without this, it's okay to go straight to the ABA, okay? The ABA can assess the level of your child directly. Now, if the behavior analyst saw that the child needs something about the physical, all right, just to confirm, because that's the first thing we need to be aware of. We need to, what's the term? We need to rule out, okay? So if ever your child has physical issues, then we need to go to the physical doctor just to check that everything is fine. If something is wrong with the physical, the reason why the child is not doing a specific skill, then we need to suggest to the parent to deal with that physical first before we can continue with our assessment in ABA. Okay, so do we need a formal diagnosis from the pediatrician, developmental pediatrician and psychologist? No. But with the physical medical doctor, or some of the doctors that, if we found something from the physical aspects of the child, then yes. Okay, so that two different scenarios. Okay, the last but not the least. All right, so how long should a child have ABA treatment or ABA therapy? Well, in our science, we have evaluation. Right after the assessment, we have the writing of the program. And with the writing of the programs, we have the progress check. We need to check the progress of the child, either with the skills that you're teaching or with the behavior that you're training. Okay, for example, you are diminishing a negative behavior, we need also to monitor that. While you're teaching also skills, we need also to check the progress. Okay, in that scenario, we don't recommend to be like fast, because it will not be depending on us 100%. Because for us, we are just giving instructions and prompts to your child. It will depend on your child's performance. So, if ever our target, for example, this time is level 1 of eye contact, if ever your child didn't do it like in 2 months for this level 1, actually, it should happen if you're doing the proper reinforcement procedure and things like that. I'm just giving you an example, okay? So if ever within 2 months a specific skill did not really improve, before the 2 months, actually there should be a change in intervention, because usually we have what we call effective. We are effective. So if the other intervention is not working with your child, we need to research another intervention, which are also effective. And then we will check if that would work with your child. So we don't stop in one intervention for a long time in a sense that it will like last for like more than a month. No, we need to at least revise, okay, in between. That's the reason why ABA is not a short-term, not just a short-term therapy. It should go at least 6 months and so on and so forth. The first evaluation usually for my programs is within 6 months. Okay, the usual that I can see in most ITPs or individualized therapy programs or IEP individualized educational program. So I would not suggest or recommend to have like, quick, I need to have this. Don't push the behavior analysts to make your child do things. You can, of course, support. As parents, please support the behavior analysts on the programs, and whatever the analysts and the therapists are asking you, please do this at home so that your child will improve as soon as possible, or whenever your child can adopt it. Okay? So there is no such thing as specifically like 3 months or 6 months. There's no such thing as that. We cannot predict. Okay, we cannot predict that long, that in 6 months he will be fine. We can predict the behaviors, and in the sense like the function, if you know the function of the behaviors and you know the precursors of that behavior, we can predict. But if you say in writing that within 3 months or within 6 months your child will have this and that, no, because ABA is a data-based science. We need to decide according to the data that your child performed first, and then we are just recording it. Okay, so if your child performed independently of washing the hands, we will record it today, this date, it is independent. And if according to the plan, if he does it independently for 3 consecutive opportunities, then that means what? He mastered it. So we will go to another target. Okay? It's the same as when you're going to school. You don't stop in grade 1. We have grade 2, grade 3, grade 4, and so on and so forth. Okay? As long as the child has become independent enough, like with the data, and then the behavior analysts confirmed that the child can be, left, no need for shadow teacher, no need for prompt, then you're good to go. You can actually discuss it with the behavior analyst, as long as the target areas of the trainings, of the skills, of the behaviors has been met. Then that's the time you can let go. Okay, so that's the time, no need for the ABA therapy, because your child can go in the more natural environment. Okay, because that is our goal, to help the child first. That's why we have one-on-one therapy session to make it more intensive. We have discrete trial training, we have natural environment training, we have direct instructions, we have lots of kinds of promptings so that the child will not emit errors. Because most of the time when the child, especially when having autism, the errorless learning is very, very, most of the time when the child is having error, then they're not motivated. So we need to have motivation. And for them to reach the motivation to get the reinforcer, they need to do the action, or they need to do the response correctly. But sometimes they don't know yet the skills. That's why we're putting the prompt. So by using the prompt, the child is errorless. Okay? So in that point, the teacher or the therapist should be trained enough to do the prompt. So I hope it makes sense. As long as your child will be independent enough, talk to your behavior analysts, talk to your therapist, and then if they say yes, he's good to go, no need for therapy, just practice it at home, so on and so forth. Make sure that the transition is properly done. Do not just let the ABA go or let the therapy go. Just transition it properly. Okay? How proper? Ask your behavior analyst. Ask your therapist. I'm sure they will have plans for that. Okay? So 3 questions we answer for today. At what age you should start ABA or the assessment for ABA? Do we need formal diagnosis from psychologists and developmental pediatrician before we do the assessment for ABA? No, but for the physical doctor, sometimes we do it. Like most of the time, we check the physical. But if there's no issue, that's good. Okay, sometimes I ask the parents like directly, do you have any physical, that the child, does the child have physical issues? If they say none, then I observe the child that he's fine, then it's okay. But if you're really in a doubt, especially you guys who are educators, therapists, analysts, then of course we know that we need to ask some diagnosis from the physical doctor. All right. So how long should a child will have ABA? As long as the child will be released accordingly, like transitioned properly with the data, okay, the data that he's independent, and with the recommendation of the analyst and the therapist. Okay, so I hope it makes sense. Again, guys, thank you so much for your support. Don't forget to like, subscribe, and hit the notification bell. Guys, I am editing a video, but taking long time before I finish it. It's really challenging for us vloggers. Well, I can call myself vlogger a little bit. Okay, so it's really challenging to edit, but I'm trying my best to finish it. Okay, so I'll see you again. Thank you so much. I hope you like this video, and share this video please to everyone, to anyone who needs it. Thank you, and God bless you all. Bye.